Hello, my name is Sarah, and I'm a nurse at University of Maryland Shore Regional Health at Easton. This is my patient, Leanne. Your doctor wants you to go home with a urinary catheter in place. So today we're going to talk about your catheter and how to care for it at home. First, the most important thing is to always wash your hands with soap and water before and after touching your catheter, the tubing, or any of the drainage bags. This is the #1 way to prevent infection. Also, it's important for you to wash your body at the insertion site of the catheter at least once a day. Wash with antibacterial soap and pat dry. Now we're going to talk about your catheter and the supplies that you will receive. Your catheter has a small balloon at the end of it. This is inside your body. You won't see this part, but I'm going to show it to you so you can see. This is what holds it into the bladder. If you pull on it, it's not going to fall out unless you pull very hard. So be careful not to pull or tug on your catheter, or it could cause injury. Your catheter will have 2 or 3 ports at the end. The colored port is what we use to fill the balloon at the end. You're not going to do anything with that. If you have a third port, this was what was used to irrigate your bladder while you were in the hospital. There will be a plug in it. If this plug should ever come out, simply put it back in with a twisting motion. The third port is what is attached to your urinary drainage bag. You will be given all the supplies that you need. This is a leg strap that we will give you, which will hold the catheter in place on your leg for your comfort. It goes around and secures with Velcro. At the top is another Velcro closure. Simply wrap it around the middle port and secure it to the strap. This will hold it in place for your comfort. Make sure the leg strap is tight enough to hold it, but not so tight that it causes you discomfort. Attached to your catheter right now, you will see a large drainage bag hanging next to your bed. It's larger and is ideal for nighttime use because it needs to be emptied less frequently. It drains by gravity, so you want to make sure that it is always at the level below your bladder. Hanging it from the side of your bed is ideal. You want to make sure that there's no kinks in the tubing as well, so that the urine can drain. You will also receive a smaller leg bag, which is ideal for daytime use. It can be worn under clothes and is discreet. It needs to be emptied more frequently because it's smaller. You should empty it when it's about half to 2/3 full. This leg bag attaches to your leg with 2 elastic straps, one on the top and one on the bottom. They have a button closure. I'm going to show you how to put it on Leanne's other leg. You want to make sure it's above the level of the knee. If it's below, and if any part is below your knee, when you bend your knee, it may cause it to pull. Okay. You want to make sure it's snug so that it doesn't fall down, but not so snug that it causes you discomfort. Lastly, you will be given alcohol wipes to clean the ends of the catheter tips. Now I'm going to show you how to change your bags. Before switching from one bag to the other, make sure you've washed your hands with soap and water and have all your supplies ready. One supply you're going to make sure you have is these alcohol wipes to clean the tip of the new drainage bag. You also want to have a clean towel or washcloth to lay down to prevent any spills. I'm going to lay this washcloth right here. Take your alcohol wipe. If you run out of alcohol wipes, you could always just use cotton balls and rubbing alcohol as well. This you're going to use to rub and wipe the tip of the new drainage bag to help prevent infection. Before pulling this rubber tubing off, you want to pinch it or bend it with your hand here to prevent any leakage. So I'm going to pinch this and just simply pull it off like that. I still have it pinched here to prevent any leakage of urine. Then you just push it on to your new drainage bag like that and kind of twist it a little to make sure it's secure. Now her catheter is draining into the smaller leg bag, which she can wear under clothes. Good. Now I will show you how to empty your drainage bags. You do not need to measure your urine. You can empty your bags directly into the toilet. For the leg bag, the smaller bag, simply lift your leg right up to the toilet, or you can unbutton the bottom strap to pull it closer. There's a little lever, and all you need to do is push it down to allow the urine to drain out. You may want to get a little tissue to dab the end if there's any drips. Then push the lever back up, just like that. When you're done, put the leg strap back on, and you're all done. Now I will show you how to drain the urine from your larger bag. You can drain your large bag directly into the toilet as well. There's two clamps. First, you squeeze this green clamp here and pull it out of the clear holder. Next, you unclamp the metal clamp right there. Allow it to drain into the toilet, and then reclamp the metal clamp and place the green clamp back into the clear holder. Now I will show you how to clean your bags. After you have switched from one drainage bag to the other, you want to clean the bag that's not in use. To clean the bag, first you want to empty it of any remaining urine. Then you want to fill it with a solution that is 1 part white vinegar, 3 parts water. After you make your solution, you want to fill the bag. You can fill it right through the tip here. You may use a squeeze bottle or even a watering can to fill the bag. Once you've filled the bag with your solution, shake it up a little bit and allow it to sit for 30 minutes. After you have let it sit, drain the bag and allow it to air dry. This can be done with both the large bag and the small bag. If you have any questions, you can refer to the pamphlet that will be given to you. It has all the information that we've talked about today and some more, or feel free to talk to your nurse or even call your doctor. Thanks for watching.